gather my materials, which are right here. Alright. Hello, my name is Tony and I'll be your nurse today. I am going to be doing your head to toe assessment. Can I please have your name and date of birth?
Kelsey Hoshkin, December 9th, 1997.
Alright, thank you. Next I will provide for privacy, and then I will complete hand hygiene. Normally I would put gloves on, but for today I will not be putting gloves on. Do you have any pain today? If you do, can you rate it on a scale of 0 to 10, 0 being no pain at all, and 10 being the worst pain you've ever felt?
0.
0? Okay. Do you have to use the bathroom?
No.
Okay. Is it alright if we start your head to toe assessment now?
Yes.
Alright. First, I will do a general survey. My patient seems to be clean, comfortable, and well nourished. Next, I will go on to assess my patient's orientation. Can you please tell me your name,
Kelsey Hoshkin,
what day it is,
Sunday,
and where we are?
at my home.
Okay. My patient is awake, alert, and well oriented. Next, I will then assess her skin. So I would assess for color, temperature, and any moisture. Temperature, I'd use the back of my hand. Okay, no abnormalities, all is normal. Next I will go on to her vital signs, which I will do her blood pressure, pulse ox, pulse, temperature, respirations, and then I would assess for any pain. Then I will go on to inspecting her head and face. Head and face seem to be symmetrical with no abnormalities. Okay. And then I will next inspect her oral cavity. I'm going to open your mouth for me, stick your tongue out. Alright, her epiglottis is intact, and then I would also assess for her gag reflex as well. Alright, next I will assess her neck and lymph nodes. Kelsey's neck seems to be symmetrical with no abnormalities, and now I'm going to palpate her lymph nodes. Alright, there seems to be no swelling in her lymph nodes. So now I will move on to auscultating first her carotid arteries, and then I will go on to palpating her carotid arteries. Auscultation was normal, there were no bruit sounds. Next, I will go on to palpating. I will do each carotid artery, I will not do them both at the same time. Okay. Alright, that's a strong pulse. Both carotid arteries are equally bilateral, ×2. So now, next, I will then move on to her cranial nerves. Cranial nerve number 1 is her olfactory nerve, which deals with the smell. So what I'm going to do is I'm going to have her close her eyes, and then I'm going to hold one nostril at a time and have her smell and tell me what she smells. Alright, what do you smell?
Chocolate.
Alright, what do you smell?
Chocolate.
Alright, your sense of smell is good. So now we will move on to cranial nerve number 2, which is her optic nerve. We're going to be assessing your vision. Now, for distance, we could use either the Snellen or Rosenbaum test, but instead I'm going to have her read this newspaper for near vision. So I'm going to have you read right here, 14 inches away, what the bottom line says, 14 inches away.
Some of the flavors are a work in progress.
Alright, thank you. Vision is good, so we will move on now to cranial nerve number 3, which is her ocular motor, cranial nerve number 4, which is her trochlear, and cranial nerve number 6, which is her abducens. All three of these cranial nerves have to do with eye movements. So first, I'm going to have her follow my finger into the 6 cardinal fields. Alright, good. And then I'm going to pass a light on her pupils. Alright. Pupils are round, equal, and reactive to light and accommodation. So then next I will move on to the trigeminal nerve, which is cranial nerve number 5. Trigeminal nerve deals with sensory. So I'm going to pass a soft or a hard object on Kelsey's face, and she's going to tell me if it's hard or soft and where she feels it. So this is what soft will feel like, and this is what hard will feel like, okay? Alright, so close your eyes for me.
Soft left forehead,
Okay.
hard right cheek. Soft right forehead. Soft left cheek.
Okay, thank you. Alright, trigeminal nerve test is good. So we will then move on to cranial nerve number 7, which is the facial nerve. Facial nerve deals with facial movements. So I'm going to have you smile for me, frown, purse your lips, and puff your cheeks. Alright, all facial movements are normal and symmetrical. So then we will move on to cranial nerve number 8, which is the vestibulocochlear nerve. Now I could use a tuning fork for the Ryan and Weber test, but today I'm just going to be performing the whisper test. So I'm going to whisper in your ear and you're going to tell me what you hear.
Dog. Cat.
Alright, vestibulocochlear nerve is good, so I will then move on to cranial nerve number 11, which is her accessory nerve. So I'm going to have her shrug her shoulders. Good. +5 strength. That nerve is good. Next we will move on to cranial nerve number 9, 10, and 12. Cranial nerve number 9 is your glossopharyngeal. Cranial nerve number 10 is her vagus nerve, and cranial nerve number 12 is her hypoglossal. All these have to do with tongue movement. So I'm going to have you stick your tongue out for me, move it up and down, left and right. Good, and then I could also perform the taste test, which I won't, but if I were to perform the taste test, I would have her taste a sweet or a sour taste, and she would tell me what she tasted. Okay, so now that your cranial nerves are done, we'll move on to your upper extremities. To start, I'm going to assess her arms. Her arms seem to have no abnormalities, no bruising or discoloration. Temperature is good. And there is no moisture. That's good, dry. Then I will palpate her radial and brachial pulses. Let me turn off one. Radial pulses are bilaterally equal ×2, and then I will go on to her brachial pulses. And her brachial pulse is equally bilateral ×2. I will then assess for her capillary refill. Now normally I would have her take off her nail polish, but in this case I'll pretend like she doesn't have it. Capillary refill is good in 2 seconds, so that's normal. Then next we will go on to range of motion exercises with our upper extremities. So I'm going to push on my hands. Good, and then squeeze my fingers. Good, +5 strength on both exercises, and that is normal. Next we will move on to your thorax and cardiac assessment. To start, I would normally have her remove here so I can assess her chest. I would assess for any bruising, abnormalities. Looking here, she seems to have a symmetrical chest, no abnormalities. I will assess her skin turgor. Skin turgor is normal. So then I will go on to auscultate her chest for her heart sounds. I will listen to her aortic, pulmonic, Herb's point, tricuspid, and her mitral. I'm going to be using the diaphragm. However, if I was listening for any abnormal sounds, such as any murmurs, I would use my bell. Now her mitral is also where I would find her apical pulse, which I would listen to for 1 minute. I will not do the full minute today though. There were no abnormalities with her heart sounds. So next I will move on to auscultating her anterior lungs. I'm going to listen to 8 spots. So I'm going to have you take one respiration. One respiration is 1 breath in, inspiration, 1 breath out, expiration. Every time I move my stethoscope, I want you to take 1 breath for me. Auscultation went well, no abnormalities to listen for. So now I will auscultate and inspect her posterior lungs. So I'm going to have you turn around. I will be doing so in 10 places on her back. First I will inspect her back. Spine seems to be normal, symmetrical and straight. And then no abnormalities on her back, such as bruises or anything I should be aware of. So next I will go on to auscultate. Now she's going to do the same thing for me. She's going to breathe every time I move my stethoscope. Alright, and now normally I would have her remove her clothing so that her back is available for auscultation, but for today I did not. Alright, so that'll complete her thorax and cardiac assessment. We will then move on to your abdomen assessment. So I'm going to have you lay on your back for me. Now this is different than any other of the assessments. Alright, so first what I'm going to do is auscultate. Well, first I would inspect her chest. So I would have removed her shirt from up to here, inspected for any abnormalities, any discoloration. Then I will auscultate starting from her right lower quadrant up to her right upper quadrant, left upper quadrant, and left lower quadrant. Okay, no abnormalities. My auscultation revealed normal bowel sounds, no hyperactivity. So next I will go on to percuss her abdomen, but for this assessment I will not be percussing, I will only palpate. I will feel for any tenderness and ask if she feels any pain. Do you feel any pain, Kelsey? Alright, no abnormalities, no tenderness. So next, we would move on to her genital inspection. I would palpate her femoral artery. Then I would inspect for any abnormalities such as tubes. Then next we will go on to her lower extremities. So I would inspect her legs, no discoloration, temperature on both sides is normal, no moisture, no excessive sweating or anything, so that's good. Now I will go on to her pulses. So right here is her dorsalis pedis, posterior tibial, and then her popliteal. All which are bilaterally equal with 2 times. So then we will move on to range of motion with her legs. So I'm going to have her bring each leg at a time up to her chest. Okay. Alright, normal. Then I'm going to have her push with her toes on my hands. Good. +5 strength there. So that will conclude with her lower extremities. Next, I'm going to have her stand up for me. And we're going to assess her gait. So I'm going to have you walk 3 steps that way, please. Okay, turn around and walk back. Okay, gait is normal. Now I'm going to use the Romberg test and assess for her balance. So I'm going to have her put her feet together, hands at her side. Then I'm going to close her eyes. I'm going to push on each side. Okay. She has good balance and no abnormalities there. So now you can sit down. And then throughout my assessment, I would have been documenting any abnormal findings. And then at the end, I would have also documented everything.